Hello, everyone, and welcome to Chapter 1 of your Pathology for Massage Therapists. This chapter covers the introduction to pathology and infection control. We're going to go over some basic terminology. I have included some files for you in your extra resources for the week section of your week 1 page that you can reference. It's also in your extra resources module if you want to go there and look for it. You will also see on your Chapter 1 PowerPoint that I have numerous pages of nothing but keywords for you and their matching definitions. But the big ones I really want you to pay attention to right now are disease. And disease is a condition of abnormal function involving anatomic structures or body symptoms. Pathology is the study of disease. Now, I want you to know diagnosis, which is the process of identifying a particular disease. And that includes evaluations of signs and symptoms, medical history, physical examinations, laboratory tests, and other procedures. But you won't do any of those. You are not a medical professional per se, a doctor, a nurse, an osteopath. You are a massage therapist. So a term that you might want to be familiar with is differential diagnosis, which is distinguishing a particular disease from others that possess similar signs and symptoms. Now, the reason that this term is important to you is you need to know if someone has simple dermatitis, like inflamed, itchy skin, or if they have something like cellulitis, which is a bacterial infection of the area and could potentially cause major issues, especially to someone who has cardiovascular disease. Or even worse, what if they have MRSA, which is another infection that is antibiotic resistant and highly contagious and could cause a ton of problems, not only for you, but for the other clients that come into your office. Now, you may be thinking, why do I need to know all of this pathology stuff? I'm just going to work in a spa or have a small private office. I'm not going to specialize in medical massage or, work with an osteopath or a chiropractic office or even in a hospice. Why do I need to know these? Well, you need to know these because every single client that you meet has a disease of some type. They have a big pimple on their back that you notice when you start working on them. Guess what? That's actually a disease called acne. Now, you're going to want to learn some of the signs and symptoms of the more popular diseases, or at least the most contagious ones. Signs are objective evidence that are obvious to someone other than the affected individual. Maybe they're slurring their words and they don't notice. Or maybe they have high blood pressure and they don't realize it, and it can't be determined until you do a diagnostic test. Symptoms are subjective evidence perceived by the individual experiencing them and include things like headaches, nausea, pain, sometimes anxiety. We can see signs of anxiety in a client, but we won't feel the same way that they're feeling, which is why it's characterized as a symptom. There are acute diseases and chronic diseases. An acute disease is something that has an abrupt onset. It suddenly comes on, it stays around for a short time, and then it goes away, usually less than 3 months. But usually we think of something that's even quicker than that, say like a 24-hour bug or the stomach flu. And then chronic diseases are something that you're actually going to see clients for quite a bit of the time. Things like fibromyalgia, autoimmune diseases. These have a gradual increase in signs and symptoms, and they last for a very long time, very frequently for life. Now, there are risk factors that you need to be aware of for some of the diseases that we're going to study in this course. Age is a big risk factor that's going to be appropriate for some of the ones that we study. Not so much gender, although when it comes to hormones, women are more susceptible for some of these diseases than men. Of course, genetics, lifestyle, and environment are all things that we need to consider as risk factors for disease. As you go through your PowerPoint, you're going to see some other terms like epidemiology, morbidity, mortality, incidence, prevalence, etc., etc. I want you to look at them and learn them, but not be too concerned about them. What I do want you to focus on as we go throughout this course are different types of diseases. Autoimmune diseases, which are a part of a large group of diseases marked by an inappropriate or excessive immune response in the body. Remissions, which are periods of disease sort of backing off. The signs and symptoms sort of disappear or diminish significantly. With people with fibromyalgia, they'll have good days where pressure doesn't hurt quite as bad, and they can come in and get their massage at that time, or if they have lupus and they're in remission, versus when they have an exacerbation period, and that's when the signs and symptoms of disease worsen or become significantly more severe, like when they're feeling chronic fatigue again, swelling, pain, fever. This is also called a flare-up or a relapse. If someone has PMLE, polymorphic light eruptions, they've been out in the sun and all of a sudden their skin erupts and boils again and they're itchy everywhere. They are in a full-blown flare-up and it is contraindicated for massage at that time. Cancer, of course, is characterized by the growth of abnormal cells that possess uncontrolled cell division, lack programmed cell death, and they accumulate into masses and tumors. They can metastasize, that means grow quickly, and they have the ability to invade other tissues of the body, taking over. Deficiency diseases are caused by a lack of essential nutrients in the individual's diet. Something like scurvy, which is simply a deficiency of vitamin C, is an absolute nightmare fuel. I should definitely post a side story about scurvy for you guys. Degenerative disease is a big one that you will probably see clients for. Those are diseases that involve tissue breakdown caused by overuse, such as repetitive sports injuries, or those that occur naturally as a result of the aging process, like osteoporosis when your bone starts to degenerate. Alzheimer's and Parkinson's disease are often considered brain degeneration, and osteoarthritis is joint degeneration. That's a super fun, painful one that will require some gentle massage techniques for sure. Genetic diseases are caused by abnormalities in the genetic code. You won't necessarily see people just quote unquote for a genetic disease, although obviously some of these symptoms that occur because of genetic diseases will definitely bring clients in for massage. Metabolic diseases occur when metabolism process fails to work correctly. That means you have too much or too little of an essential substance, such as a hormone. You can have Cushing's disease, which is like an overproduction of cortisol by the adrenals, and even diabetes, which is caused by elevated blood sugar levels because your body has the inability to produce or use insulin, which is made in the pancreas. The big one that you need to be concerned about as a massage therapist are the infectious diseases, which are caused by pathogens such as bacteria, fungi, viruses, protozoa, and pathogenic animals. What you need to worry about these infectious diseases or communicable diseases is that they are contagious and that they can go from one person to the next. But we will cover those in detail in just a little bit. There, of course, are congenital disorders, traumatic disorders, which involve injury to the body tissues and are often caused by violence or accidents. This is something that is very interesting to specialize in as a massage therapist. And even if you go work for a chiropractor, very often you will be dealing with traumatic event injuries such as car accidents. There are also local and systemic diseases. And then I really want you to pay attention to different types of pathogens. Okay? You're going to learn the main ones, which are viruses, bacteria, fungi, protozoa, prions, and pathogenic animals. I have information on those and also on the chain of infection in your Chapter 1 PowerPoint. Now, for your massage clinic, you are going to be very concerned with disease transmission. I don't care if you're in a spa. I don't care if you're somewhere especially in a hospital, because definitely people are coming in that are infectious, usually at a higher rate than what they would be at a spa. Places like cruise ships, if you become a cruise ship therapist, you are potentially looking at being in close quarters with hundreds of people where transmission is super easy. So what is disease transmission? Well, you can have contact transmission, which can either be direct or indirect. Direct contact transmission occurs when there's direct physical contact between an infected person and a non-infected person, like touching, like shaking hands, or giving a massage, giving them, a quick kiss, or even sexual acts, which you will not be doing with your massage clients. You need to wait at least 6 months to ethically begin a relationship with a prior massage client. Please keep that in mind. Indirect contact involves disease transmission from contaminated objects, infected droplets, or any object called a fomite that the infected individual has touched and becomes contaminated, like they touch a doorknob or a light switch, and then they leave particulates behind. And then to complete the chain of infection, you touch the light switch, you touch the doorknob, and boom, you have it. Diseases that are easy to pick up this way are athlete's foot, pink eye, and even strep throat. Droplet transmission is usually through a cough, a sneeze, or spitting. Even talking, you only have to be 3 feet away, or sometimes even 6 feet away, for droplets to land on you. And unless your arms are at least 3 feet long, if not 6 feet long, you're in close contact with that talking client while they're on the table. So definitely any type of droplet transmission is something that you're certainly going to be susceptible to. Most respiratory tract diseases are spread by droplet transmission. Now there's something else called vehicle transmission, which could be food or water or air. And in the case of massage therapy, you're really only going to care about airborne transmission. Now, pathogens can travel on droplets again, but they're small. They're so small that they can actually ride on dust particles in the air. They can float farther than the 6 feet, and they can hang out in the air much longer than the heavy droplet that you would expect in someone's spit or in their sneeze. Vector transmission is less important to the massage therapy office because it usually involves an animal or an insect. So unless you have, a massive infestation of some type, luckily this is one that we don't need to cover in too much detail in this course. I am including a table for you out of your book. It's table 1.1 in your chapter 1, and it shows various pathogens, the reservoir, or where these pathogens live and are kept, and the disease that it causes. Things like Staphylococcus aureus, which is a very common beneficial bacteria that lives on the skin, on the hair, and the nose. If it proliferates any type of wound or becomes overgrown, the bacterial colony becomes too large, it can cause things like cellulitis, pneumonia, acne, boils. It's pretty impressive. So just go through this table for a few moments. Go ahead and pause the lecture and just see what you recognize, what you don't recognize, and think about ways that you would protect yourself from transmission from these various pathogens. Now, what happens after you get a disease or an injury? One major thing that we need to worry about as a massage therapist is inflammation. Now, inflammation is a protective response to tissue damage, And that can come from a variety of causes, not just infection from a disease or a bacterial agent, but also mechanical injury or chemical damage, ischemia, which is oxygen deprivation, nutrient deficiencies, and even temperature extremes. Now, acute inflammation is the initial response, and you're going to see swelling, heat, redness, and pain, and sometimes a loss of function. As the swelling becomes so much, the joint sort of immobilizes itself. That is a contraindication. You are not going to work on an acute inflammation on someone's body. Now, sometimes people can have systemic inflammation, which is associated with fever and a temporary increase in circulating leukocytes or white blood cells and plasma proteins. When somebody has a fever, that is another contraindication. Now, chronic inflammation is something that lasts at least 2 weeks or longer, and it follows an unsuccessful acute inflammatory response. When someone has chronic inflammation, such as osteoarthritis, GI diseases, Crohn's disease, that is often in the body and not necessarily in the skin. That is something that you can work with under certain circumstances as a massage therapist. And as we delve into these future chapters throughout the course, we will cover those in more detail. Now, I keep throwing out the word contraindication. What does that mean? A contraindication is a situation that requires the therapist to modify techniques or refrain from using them to avoid possible harm to your client. So situations that might represent contraindications include the presence of disabilities, impairments, allergies, diseases, surgeries, recent injuries, the use of devices such as pacemakers, artificial joints, some types of medications is a contraindication. And again, we're going to cover these in more detail as we go throughout. In fact, one key that I've done for you for some of your PowerPoints in these future chapters is if you see it in pink or in red on the PowerPoint, it is an absolute contraindication. Now, an absolute contraindication represents situations in which therapy should be absolutely postponed. You're not going to massage this person whatsoever. And these are contagious diseases, widespread infection, or systemic inflammation, often indicated by fever, which is why in my PowerPoints, I use my stoplight. Green means a massage is indicated. Yellow is my pus yellow indicator. And red is my red fever stop. It is absolutely contraindicated. This is your fever red stoplight. Now, my pus yellow stoplight is a local contraindication. Just like pus in a boil, it's an area in which the massage must be avoided because it's either injured or inflamed. It's part of a disease process, or there's a medical device that you need to avoid in that area, or even a pharmaceutical product like a medicine patch. You need to go around those areas, but the rest of the body might be able to be massaged. In the cases of local contraindications, we're going to talk about treatment modifications. Now, that could mean changing their position to a semi-reclining one, using a seated position. These are called positional modifications, or even procedural modifications, which means you're going to use a different pressure technique, like you're going to be extremely gentle and light, or you're going to assist them if they're frail and they cannot get into a seated position after the massage easily. Now, the big thing that you need to remember from chapter 1, if you don't remember anything else, is standard precautions. They are the minimum infection control measures used in healthcare settings, regardless of the suspected or confirmed infection status of the client. Things like hand washing, appropriately changing your linens, using a pump cap for your lotions rather than dipping your fingers in. There's nothing worse than some rancid lotion with someone's bacteria stuff in there. Absolutely horrific. I have some information in your PowerPoint about it. I also have some videos for you to watch. that are in the extra resources section on the week 1 landing page. Feel free to gross yourself out, but absolutely practice good hand hygiene. Use disposable gloves when needed. Always appropriately wash contaminated linens. You need to disinfect all massage equipment and tools. Use sanitary techniques to dispense massage lubricant. Practice good personal hygiene. And maintain clean and sanitary offices, toilets, and treatment rooms. All right, personal hygiene is highly appropriate, not only for you, but as a personal policy for your clients. I cannot even begin to tell you the number of people that would come see me as soon as they got off work, especially in the construction industry. And massaging them, I would literally get rolls of dead skin and dirt that I would have to remove from the client as I worked on them or pick off of my massage linens. I very often had ruined sheets because of the absolute filth I was massaging off of people's bodies because they didn't practice good personal hygiene before coming into the office. I wish I was making that up. I've included a hand washing video for you as well as massage therapists. I highly recommend washing up past the elbows for sure. This is something that is very important for you to do because very often you will be using even your elbows as a massage tool during the session. I recommend having hand sanitizer available with an alcohol content at a bare minimum of 60%. I actually recommend a little bit higher myself. And when in doubt, you can also use disposable gloves. Now, they may not be comfortable to perform an entire massage in, but if there's an area that you are questionable about, and absolutely if you're doing oral work on a patient to get to the pterygoid muscles or something inside of the mouth, you absolutely need to use disposable gloves. The proper way to remove the gloves is by grabbing them right at the rim, pulling them down over your hand, and using one to flip over the other one and put them in the trash. I have included photos of that procedure for you in your Chapter 1 PowerPoint. And that about covers it for this. I really recommend that you do look at the extra videos that are posted. If you have any questions about the quizzes or any of the information in your chapter, please feel free to reach out to me. Shoot me an email at any time. I am chronically sleep deprived, so I will probably answer you at weird hours. And please, absolutely, if nothing else this course, if you just look over the other work and don't read your book, at least read Chapter 1 about standard precautions. It is extremely important for your safety, for your client's safety, and even for your family, so you're not bringing home any type of pathogen from your workspace to your house.